Good Saturday morning to everybody, and welcome to HyperFit MD Radio Show, along with Dr. Charles and Francesca Guglin. I'm Gary Byron. Hey, good morning, folks.
Good morning.
How are you?
We're good.
It's good to see you.
Yeah, we've been away.
A couple of weeks. Peter was in here.
Yeah.
Or we had him, I think we had him on the phone, right?
Right.
Yeah.
Right, yeah.
But there's nothing like having the two of you live in the studio. How's your week?
We just got back. We were in Francesca's home country of Malta for a couple of weeks, saying goodbye to a loved one.
I'm sorry.
And just kind of organizing things there. It wasn't much of a vacation, but got to swim in the beautiful Mediterranean and ate a lot of food.
Yeah, I was going to say, I remember one time not that long ago, we were talking about a Mediterranean diet, remember? A few weeks back, yeah.
And that water's just beautiful. I can't stay out of it. And the thing about Malta, it's such a small place that you wind up, I mean, if you had a bathing suit on all day long, you'd go swimming every other hour if you wanted to, because you're always within sight of the sea. It's just it's always there. It's ubiquitous. Yeah, it's really nice.
Yeah, rub it in.
Yeah.
Rub it in. I think when you were having the beautiful weather and how you're describing, we were having, I was going to say enjoying, but we weren't enjoying unseasonably cool and rainy weather.
Yeah.
So,
well, how can you say unseasonably when you talk about the state of Connecticut? I mean,
you're
really,
right.
Yeah.
You're right.
Yeah.
It should be warm.
Yeah, right. I mean, we're now a few days into June here, and it should be. It is warm. Today's holy cow. Today's a scorcher.
Yeah.
It's going to be even hotter today.
Yeah, well,
it
is what it is, and then next week it could be worse. It could be cold and rainy.
Who's it that? Our producer here, Ryan, says perfect temperature would be like 70, 75, just year round.
San Diego. San Diego. San Diego is like between 75 and 80 and 50% humidity, 365 days a year. It's amazing, yeah.
Who wouldn't want that?
I can't imagine who.
That's why everybody's happy down in San Diego, right?
Seduced my kid. It got him to L.A.
Is that right?
Well, he went to college in Chicago, the Windy City. He spent 4 years freezing his butt off and did 6 months at Paramount Studios and fell in love with L.A. and he never went back. I mean, he never.
What does he do?
He's in the movie business. He's a producer. Yeah,
nice.
Yeah, he's doing really well, actually.
I'm happy to hear that.
But he loves L.A. I don't think he'll ever come out of there.
I love L.A.
Yeah.
All right. Today, we're going to talk about something that I know affects a lot of people.
Absolutely.
And whether it's not you directly, my friends, it could be your wife, it could be your mom, it could be your sister. Not even necessarily women, though. It could affect men. I only know women who talk more about issues with this topic, and that is thyroid. Well, let's start with this one. Where is the thyroid? Where's the thyroid gland located?
A thyroid gland it's like Mother Nature's bow tie. I mean, it sits right across your neck, at the base of your neck. There's two lobes to the thyroid, and the part that's in the middle that kind of drapes over your trachea is called the isthmus, and it's literally shaped like a bow tie. It's something that when you swallow, when a physician is trying to palpate or to feel your thyroid, this is really hard to do because it's hard to do on demand. He'll stand behind you and put his hands right here at the base of your neck and ask you to swallow. Because when you swallow, the thyroid rides up and it becomes possible to feel it. Quite frankly, if you can feel your thyroid, it's time to go to a doctor because it's not an easy thing to feel. If you can see it, definitely go see somebody. So that's where it is. It also contains in it two glands called the parathyroid glands, which are pretty much responsible for calcium metabolism. But that's a whole different subject.
What is its purpose, then?
The thyroid gland, thyroid hormone does a lot of things, but at its base, what it does is it sets what's called your resting metabolic rate. It is a hormone that, first of all, every single cell in your body has receptors for thyroid hormone. It is a hormone that basically is a potentiator for every energy-creating pathway in your cells and in your body. So in that regard, it sets what's called your resting metabolic rate. What is a resting metabolic rate? We actually measure it in our practice. But what's called the RMR, the resting metabolic rate, is the number of calories that you burn per day sitting in that chair. Okay, the number of calories that you burn, because your lungs consume calories when you're working. Your heart consumes calories. Your brain consumes an enormous amount of calories. Your muscles, muscle mass is the primary determinant of a person's resting metabolic rate because it's the biggest mass of calorie burning tissue in your body.
So you can sit down and I can sit here and burn calories. Though.
Yes, as we speak, you're burning calories. Yeah, not enough, but not enough, as couch sitters can tell you. So the thyroid hormone, to a large degree, is responsible for that. The thyroid also secretes a hormone called calcitonin, which again plays a role in calcium metabolism, but it's not much of a role. It's not worth talking about in this particular setting.
Is there a particular reason why we even need a thyroid?
Yeah, we need it because let's talk about what happens when your thyroid's not functioning. Okay. What are the principal symptoms of hypothyroidism, of not having enough thyroid hormone? Fatigue, number one. A person walking into a physician's office complaining of fatigue is kind of a chronic problem, needs to have their thyroid checked. And a number of other symptoms come with it. Fatigue, hair loss, weight gain, all of the kind of symptoms that would come from basically feeling like you're out of gas all the time. So those are the principal symptoms of hypothyroidism. Hyperthyroidism is the other side of the spectrum. Hyperthyroidism, in other words, too much thyroid hormone, which is typically an autoimmune disorder called Graves' disease. The symptoms of that are weight loss, feeling hyper. Sometimes it gets so bad that a person will go into have arrhythmias, cardiac arrhythmias as a result of it. Again, hair loss, which is weird because the symptom of both hyper and hypothyroidism is hair loss. Inability, loss of appetite, inability to sleep, all the things that would come if you were kind of supercharged by some kind of hormone. So it kind of runs a spectrum in terms of the symptoms that come from it. So managing thyroid really has a lot to do with asking a patient how they feel. It's not so much about numbers per se, which is one of the things that we deal with a lot in our practice. One of the first things that when a person comes through the door in my office, the first thing I ask them is how do they feel, and thyroid plays a large role in terms of managing to a certain degree what a person feels like from day to day in terms of their feelings of having enough energy to get through the day.
I always hear, I've heard nearly throughout my entire life. Well, my adult life, where I have an overactive thyroid, or I've got a thyroid issue, know. Yeah. And there's a lot of people. It affects a lot of people. But I said this in the introduction where I seem to hear it more from women. But that can't be true, right? I mean, men can have thyroid issues.
I think statistically you see hypothyroidism, you see autoimmune disorders of the thyroid more in women than in men. I think it's I think you're right about that. It does happen more in women.
What's the connection then? What's the why? Why is that?
Good question. I have no idea. Yeah, okay. I have no idea.
Can you have a situation then where you have too much thyroid hormone?
Yeah, we talked about that a little bit. It's one of those things when you're managing thyroid in patients that you need to be cognizant of. One of the things that we deal with in our practice quite a bit, because in our practice we use thyroid frequently as a tool, as opposed to the allopathic way of managing thyroid, which is to basically look at the numbers. And as long as the numbers are anywhere in the black, let's say, on your lab values, that physician will tell you that your thyroid is okay and sort of pat you on the butt and send you out the door. Frequently, when you talk about too much thyroid, one of the things that we monitor when we are optimizing thyroid in patients is how they feel. I tell them, if you feel like you're over-caffeinated or if you feel anxious during the day, feelings that are foreign to you in one way or the other. Because typically we're prescribing thyroid for people who complain about fatigue. So what we're trying to do is get them to drift up into an area where cognitively they're working better, physically they're working better, maybe their workouts are working better in terms of helping them lose weight, or the dietary manipulations that we're doing are helping them to lose fat. If that pendulum swings too far, they start to feel anxious. They start to feel kind of, like I said, overcaffeinated is the best way to describe it. So that's really kind of the signs of getting too much thyroid. The main reason I wanted to talk about this today is because, in terms of age management, as a person gets older, as a man goes through andropause, as a woman goes through menopause, typically thyroid function falls off. And part of the problem in the allopathic world is that ranges of normalcy, when you're looking at the numbers, are huge. So as long as a person falls anywhere in these normal ranges, from an allopathic standpoint, their thyroid, they're what we call euthyroid, or their thyroid is fine. If you look at the guidelines from the American Academy of Clinical Endocrinologists, they talk really more about asking a patient how they feel, which infrequently and typically in medicine today is not the way this kind of thing is handled. Okay, they'll do your yearly labs, your labs in terms of your, first of all, we'll talk about that in a second, but the labs that they take, which typically is not enough, look into, because you can look a lot deeper into thyroid than on average is looked at. As long as those labs are in the black, they'll say that you are euthyroid and you're doing fine. Now that person who's down in the sidewalk now, she's working her way to her car and she's been losing her hair, and every time she stops moving, she falls asleep. And despite everything that she's doing in the kitchen and in the gym, she's turning into an apple. She and all of her friends say, gee, it really sounds like hypothyroidism. You really go see your doctor. She may be euthyroid from a laboratory value sense, but not in terms of having her thyroid optimized, in terms of optimization of thyroid levels, which is what we do in a practice like ours. Okay. Let's talk a little bit about thyroid hormone in itself and how it works. Everything in the endocrine system is a feedback loop. Okay. Feedback loop in terms of the fact that as your levels of thyroid come up, let me back up a little bit. Your hypothalamus secretes something called thyrotropin-releasing hormone, which stimulates your pituitary to secrete thyroid-stimulating hormone, or TSH, and that whips your thyroid, tells your thyroid to make more thyroid hormone. Typically, your thyroid makes mostly T4, which is kind of like a 20-watt bulb. It's not very active at all. T4 is then, much of it is converted in the tissues, mostly the liver, but in fatty tissues and so on and so forth, into T3, which is very much the active form of thyroid. And that conversion of T4 to T3 is very dependent upon how much thyroid you actually need from a metabolic standpoint. And then that feeds back on the TSH levels, which will drop down as your thyroid levels come up. So typically what's looked at during that yearly set of lab values that your doc looks at is TSH, thyroid stimulating hormone, and T4, because he's looking at the stimulatory effect of your pituitary, and then the T4, which feeds back on that. So as long as that TSH level is within a normal range, which is a ridiculous range, it goes from 0.3 to 5.5 nanograms per deciliter. So that is literally a 1,500% range. Mm-hmm. Would you accept that range in any other aspect of your life? No. Okay. What if your tire looked a little bit flat and you looked at it and it said, fill your tire to 5 psi to 36 psi? Where do you want it? Where do you want it? You want it at 36 psi.
Of course.
Okay.
Yeah.
What we do in a practice like ours is, first of all, we look much deeper into the thyroid. We look at T3 levels. We look at an entity that's called reverse T3, which interestingly enough is something that some people make. There's literally a mirror image of that T3 molecule and occupies thyroid receptors but does not function. So basically it helps, it reduces the effectiveness of your levels of T3 in your blood. So anyway, we look at much deeper at those numbers. And from our practice standpoint, what we do is we optimize those numbers, okay? So you're a 55 or 60-year-old woman, and you are complaining about fatigue all the time. You're complaining about cognitive dysfunction. Let's say you're a lawyer, okay? And you do all of your lawyer work between 8 a.m. and 12 p.m. because in the afternoon you're just crapped out. You have no cognitive ability at all. You used to have a big, thick head of hair, and it's kind of falling out slowly over a period of years. Your skin is getting dry. Your nails are brittle, so on and so forth. But you've been to your doctor, and he tells you that you're a euthyroid because he looked at your TSH level. It was normal in that huge normal range. So what do we do under those circumstances? She's already told me how she feels. So we look at her thyroid numbers, and we optimize things until we get her to a point where all of these symptoms go away. Okay? That's how we fly in the face of what
That
is
could take a
considered-
while.
Yeah, yes, it takes a lot
It's
of
like
monitoring.
process of elimination, right?
It takes a while. It takes a long time. It takes a lot of time with the patient. It takes a lot of time. It takes a lot of blood work because, I'm a physician. I'm an MD. I'm not fooling around with this stuff, but this is a way of optimizing the way a patient feels, is to get these numbers in the optimal category, as opposed to just anytime they're in the black, say, you're fine. So much of the work that we do in our practice has to do with optimizing thyroid, just the way we talk about optimizing testosterone and estrogen and progesterone and all the other things that we've already talked about in the past on this program. Thyroid is critical. It is critical because of that resting metabolic rate aspect of it, just to complete the circle. You really want to optimize it so that all of the work that they're doing, especially if they're in fat loss mode, is getting them somewhere. Nothing is more motivating than results. Ryan came in the door today, and everybody congratulated him on the fact that he's lost weight. He's going to do a lot better because people are noticing. You notice when your brain is working better for you. You notice when you get on a DEXA scan and you actually find out that you've gained 5 pounds of muscle and lost 5 pounds of fat, even though the scale lies to you and tells you that you haven't lost anything. Those kinds of things. So in our practice, we use it to a certain degree as a tool to help people achieve very specific goals.
Very interesting. Oh my goodness. And we talk about if you, a situation where you have too much thyroid hormone. What about too little?
Mostly, again, cognitive dysfunction, fatigue, weight gain. Interesting enough, you're tired all day, but you have difficulty sleeping at night. All the symptoms that we've discussed, and it's very common in the older population. We do a lot of work with older people in terms of optimizing thyroid. The kind of gestalt in the allopathic world about optimizing thyroid in older people is that it can cause cardiac arrhythmias. There's really very little evidence to that effect when you're talking about exogenous thyroid optimization. In other words, giving people thyroid hormone. What they are they're mistaking Graves' disease, which is an autoimmune disorder, and there's no such thing as autoimmune disorder that just affects a single part of your body. Okay, Graves' disease is an autoimmune disorder that affects your thyroid, but also affects your heart and every other aspect of your health as well. Most autoimmune disorders do, and people with Graves' disease, in other words, hyperthyroidism, too much thyroid as a result of an autoimmune disorder, have an increased incidence of cardiac arrhythmias, particularly atrial fibrillation. There's very little in the literature that says that optimizing thyroid by using exogenous thyroid puts a person at risk for cardiac arrhythmias. The psychiatric community, for instance, have been using thyroid for years and years for depression. Recalcitrant depression, a person who's on 2 or 3 medications and is still depressed. There's much in the psychiatric literature. These guys will give people thyroid until they feel better, until the depression goes away, and not even really pay too much attention to
they're using a thyroid medication to combat depression?
Yeah.
When it has nothing to do.
It's been going on since the 40s and 50s. I mean, it's a very old treatment for depression because it works. Who knows where your depression comes from, okay? You can be chronically fatigued and be depressed as a result of that. Okay, so and the psychiatric community has been using thyroid very large doses of thyroid to combat depression, and there's very little in the way of literature that says that this has resulted in an increased level of cardiac arrhythmias in those patients.
Fascinating. Folks, you are listening to HyperFit MD, Age Management, with Dr. Charles Guglin, Francesca Guglin. You can contact them. Check out their website at hyperfitmd.com. I'm Gary Byron. All right, so if of the two, you said that seniors more or less have the too little. Excluding that,
Yeah.
do you find that more people, is it too much, or too little?
Graves' disease is an uncommon disease. More Hashimoto's. One of the things that I ran across was that I didn't mention. Hashimoto's thyroiditis is the name of the autoimmune disorder that is the principal cause of hypothyroidism, clinical hypothyroidism in the Western world, okay, or in the first world, let's say. In the third world, it's mostly iodine deficiency, nutritional deficiency, and so on and so forth. But in the first world, it's typically an autoimmune disorder called Hashimoto's thyroiditis. So the vast majority of thyroid hormone that's prescribed in this country has to do with autoimmune disorders that cause hypothyroidism. We treat that too, but most people who come to our practice with Hashimoto's are already being treated by somebody, by an endocrinologist.
Okay.
Yeah. So,
how is thyroid hormone used in your business, in age management?
it's used, like I said, it's used as a tool for the most part. Our practice is really about, from a hormonal standpoint, we do a lot of other things, but we're talking about hormonal aspects of the practice. It's all about optimizing hormones. It's all about getting a person with testosterone, getting a man back to the levels that he was at when he was between 25 and 35. It's getting him back to feeling the way he felt when he was that age, from a sexual standpoint to a muscle building standpoint to so on and so forth. With a woman, it's prescribing estrogen and progesterone and testosterone to get them metabolically and hormonally back to where they were premenopausally. With thyroid, it's the same thing. It's about optimizing these levels. We do draw blood levels pretty frequently on people that we are optimizing these levels on. We do watch these numbers very closely, but quite frankly, it really, from my standpoint, has more to do with how they feel.
Well, you're my new best friend. I mean, I'm 51. You can make me feel like I was going to say 21. Hell, I'd be happy to feel 30, 31, even 40, maybe even 41, actually.
I'm 65. I'll take 50.
Well, you look fantastic for 65, but of course, I would expect you to. I mean, you have all the secrets of the trade.
Well, we try to walk the walk.
I think you clearly do.
Yeah.
What I didn't understand, though, is that, how overactive thyroid can cause you to gain weight, right?
No, overactive thyroid typically
lose weight. Okay, all right.
Yeah.
It's an underactive thyroid, right? Mm-hmm. That'll make you gain weight.
Yeah.
In that thyroid medication combats depression. That's
sure. Yeah, it's utilized in the psychiatric community to combat depression. It's not a first-line drug at all nowadays. With SSRIs and the other medications that are used for depression, we're really talking about old school psychiatry. It's really not used that much anymore for depression because there's better drugs. But when the better drugs don't work, you can move to that because it's very effective.
Oh. Okay.
Yeah.
How do you get ahead of this then? How do you prevent from having either an overactive or an underactive thyroid?
It really it's one of those things where symptoms surface. Number one, you need to speak with a physician who thinks about it and does the appropriate lab work and stuff like that. So it's one of those things that the complaints, for instance, from hypothyroidism are very much complaints that you hear from people all the time. I'm tired all the time. How often do you hear that? Most people, when they go through menopause and andropause, start to lose their hair a little bit. Their hair thins out a little. From an energy standpoint, from a weight gain standpoint, most people, when they go through these changes of life, these hormonal changes of life, tend to gain weight. So it's one of those things that you have to think about before you can diagnose it.
So not only is this common, it sounds like it's downright normal.
To what? To be fatigued?
Well, yeah.
It's something that you hear every
Sure.
day in a
Yeah.
practice like mine. Yeah, it's sure. It's a principal complaint of a lot of people that come through the practice, and it's one of the things that you have to think about. It's one of the things that you have to study, in that person. Like we said before, every patient that comes into our practice is an N of one scientific study, all right? So part of studying that person is knowing where they are in relation to these hormones and these hormonal levels.
I find it fascinating. I really do, because I've heard from oh my goodness, countless people
Sure.
about their thyroid issue.
Yeah.
And I never could quite understand, well, what exactly, when you say that, and it's, I'm on this, I have a thyroid condition, and I've gained so much weight. That's what I hear more than, and I've lost so much weight.
Right.
And I'm sorry to say this, there's no method to this. Don't read between the lines. I'm just telling you by my experience, I hear it more from women than I hear from men.
Yeah, it is more common in women.
Yeah. Very, very interesting. All right, folks. Wow, what an interesting topic this is. Of course, they're all interesting, but I think this one really hits home, particularly for a lot of women who are, I would imagine, middle-aged in particular, right? This is when you really start feeling
Well, if you're young,
the symptoms.
If you're young and you're in your 20s and you're dragging your butt all the time, that's one of the first things you should be looking at. So but profound fatigue in a 25-year-old is something that they typically go to a doctor about right away. You get to a certain age, you feel fatigued. You say, "Well, I'm just old," you pass it off.
Write it off to age. It's age.
Yeah, you find that dent in the couch that has your butt's thing, and you just you just put it there. Yeah.
Well, we're talking age management, so this would be at the forefront of that if you ask me. You can contact HyperFit MD. They've got a fantastic website. It's simply hyperfitmd.com. Once again, hyperfitmd.com. They're also located 88 Noble Avenue, Suite 105 in Milford, Connecticut. You can contact Dr. Charles Guglin over at HyperFit MD at 203-890-9777. Once again, area code 203-890-9777. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Thank you so much for listening to HyperFit MD Radio Show. Until next Saturday, have a good one, everybody. So long.